Hello, welcome to Chairside Live. I'm Megan Strong.
And I'm Will Schmidt, Registered Dental Assistant here at Glidewell Dental.
Today's episode, we're continuing Dr. Muresan's three-part BruxZir Esthetic veneer case. This is part 2, episode 2. The first episode was all about the treatment plan. Now episode 2, well, what do we got in store?
Well, I tell you what, in Dr. Muresan's own words, lasing is amazing when you have gummy smiles for miles. That's exactly what we're talking about today.
Okay.
Dr. Muresan is going to change the gingival height using a series of gingivectomy procedures over time and allowing them to heal. Well, let's see how this works.
Let's check it out. Dr. Muresan?
Welcome back. Let's dive right in where we left off from the last episode and continue with the treatment. I always start the process by looking at the incisal edge position. Then I continue looking at the tooth proportions versus gingival display, and most importantly, at the osseous crest position. To help in communication, I showed the patient that only closing the spaces will not address the gummy smile and the tooth proportions. To determine the ideal gingival margin that will suit the patient's smile, I created the markings and showed the patient that the actual gingival margin have to be moved more apically. From the diagnostic workshop, I create a mock-up to help plan the ideal gingival display and tooth proportions. Snap on the trial smile and let the patient see what the final result would look like. When looking at tooth proportion, it's not just looking at a number. For example, the average length of a central incisor is 10.5 millimeters. Instead, we have to look at the width to height ratio, which for central should be between 75 to 80%. Next step is to sound down the bone using a perio probe or a bone sounding gauge to decide if I need osseous recontouring or just gingivectomy. This will give me an idea of how much tissue can safely be removed to improve the tooth proportion and correct the gingival asymmetry. I like to use the bone sounding gauge because it is easy to manipulate and provide easy access due to its curved tip. There are 3 markings you can see on this bone sounding gauge. First marking denotes an average sulcus depth of 1 millimeter. Second marking denotes the mid-facial osseous crest location, which is about 3 millimeter on average. The third marking denotes 5 millimeter interproximal bony peak. For these patients, the sulcus depths on the facial range from 5 mm to 6 mm with the CEJ hidden under the sulcus. For this reason, I don't need to raise up a flap and create osseous resective surgery to assess a new biological width. Instead, I can use my Picasso light diode laser to safely remove 2 to 3 mm of excess tissue to improve the pink aesthetics. The next step in correcting the gingival asymmetry, we look at the existing tooth height and compare it with the proposed height on the diagnostic model. On average, the length of a lateral is about 9 mm and a central is about 10.5 mm. We can use the snap-on template or mark the zenith and remove the gingival excess with a diode laser. I use brush-like strokes with the initiated tip and have my Picasso light laser set at 1.8 watts continuous wave. The tissue management with the Picasso light diode laser is easy and clean without bleeding. The healing is rapid. I use perio gel to aid with tissue healing, and most patients report very little to no post-op discomfort. I send patient home with this PerioScience gel and instruct to apply 5 times a day for 5 to 7 days. After a period of 4 weeks, the patient came in for evaluation. We can see here that the gingival margins of the centrals are still lower than the laterals, so we can go ahead and recontour it. The correct position for the gingival margins was determined using tooth proportion beginning at the reference of the correct incisal edge location. The information was transferred to a model and another snap-on trial smile was created to show the patient the ideal result. Patient was asked to return in 6 weeks. Join me in the next episode for final delivery of 10 no-prep BruxZir Esthetic veneers. Thanks for watching.
Well, thank you so much for that, Dr. Muresan. And be sure to come back for the final episode of this 3-part series.
And if you missed episode 1, of course, you can head to chairsidelive.com to get filled in on all the details. But for today, this episode's all wrapped up. So on behalf of everyone here at Global Dental, thank you so much for watching.
And we'll meet you right back here next time.